Okay. Some therapeutical procedures we are discussing in the past class. No?
Yes, sir.
One is psychoanalytical approach. Already we have discussed yesterday. Today, other therapeutical procedures we will discuss. Therapeutical techniques. Okay. Yes. Any doubts after regarding the study class? In psychoanalytical approach, one is structure of mind, then topology of mind. Okay. And some developmental stages of mind, developmental stages of psychoanalytical approach, Sigmund Freud's, then defense mechanism. These are all the topics study we discussed in the psychoanalytical approach. Okay.
Yes, sir.
Yes, sir.
Is it okay?
Yes, sir. Yes, sir.
Any doubts? Yeah. Next one is behavioral approach, behavioristic approach. Okay. In behavioristic approach, one is classical conditioning theory that we have to discuss today. That is the classical conditioning theory, operant conditioning theory, social learning theory. These are the three theoretical basis of behavioral approach, or you can say behavioristic approach. Classical conditioning, operant conditioning, and the social learning theory. So here in the classical conditioning theory, Skinner, P.F. Skinner is the profounder of classical conditioning theory.
No, it is Pavlov, no, sir? Classical.
Classical conditioning theory. CLASSI.
Yeah.
CLASSI.
That's right.
Classical conditioning theory.
The proponent is it Skinner or Pavlov?
Hello. Hello.
Yes, sir.
Yeah, classical conditioning theory proponent by B.F. Skinner. This theory is also known as the RS theory, response theory. Classical conditioning theory. In the classical conditioning theory, so you know that behavioristic approach means behaviors to be modified in your counseling procedures. Okay, behavior modification. So there are some abnormal behaviors and normal behaviors. As a psychological counselors, it is our duty to identify the abnormal behaviors. Okay, so if there is any abnormal behaviors, if you find in your client, so we need to modify that abnormal behavior to the normal behaviors, from abnormal behavior to normal behavior. That is the behavioristic approach is based on some theories of classical conditioning, operant conditioning, and social learning. Okay. So here, behavior as a scientific theory, behavioral therapy, cognitive behavior therapy. In behavior therapy, one what is the basic theory is the classical conditioning theory. Okay. In classical conditioning theory, we need to identify some sort of unwanted behaviors. For example, the basic characteristics of this theory is behavior is the therapy deals with the client's current problem. So latest issues. As I mentioned in your process of counseling, first of all, when the client approaches you, you have to identify the problematic behaviors Okay, the current problematic behaviors. The client's current problematic behaviors we have to identify first with the help of the caregivers, or directly can ask this information from the client also. So first of all, identifying the behavior of this abnormal behavior of the client or the patient or the subject or individuals. Okay, so if we need to involve the client in modification of the behavior. This modification of behavior. So in this modification of behavior, some sort of behavioral treatment interventions. The interventions, the treatments are related to the purely to the client, based on the client's age, based on the client's current this abnormal behavior, current status. Okay, here there are some goals of behavioristic therapy. In behavioristic therapy, we have to set some goals. Okay, one is identifying the unwanted behavior or normal behavior. Second is eliminating the unwanted behaviors, removing the unwanted behaviors, or eliminating the unwanted behaviors or abnormal behaviors. Then the next one is promoting the desired behavior, improving the desired behavior. Number one is identifying the behavior, or you can say problematic behavior or abnormal behavior. Number two is removing or eliminating the unwanted behavior. Okay. Third is promoting the desired behavior or enhancing the normal behavior, or you can say desired behavior. First of all, eliminated unwanted behavior. Second is promoting the desired behavior. Third is reducing the unwanted behavior. If it is possible, you need to delete that, you need to remove that, eliminate the behavior, others reducing that unwanted or undesired behavior. These are some goals you have to set when you are applying this behavioristic model of the counseling. Or you can say that. Okay, in this one is classical conditioning theory, second is the operant conditioning. Operant conditioning, classical conditioning, both are conditioning. One is operant conditioning, second is the classical conditioning. In operant conditioning, we have some techniques of using this operant conditioning. This operant conditioning is known as the SR theory or SR conditioning theory.
Excuse me, sir.
Yes.
Please share the notes, sir.
See, actually, as I told you in the previous class also, notes is not, we are not supposed to give them. We are not ready to give the notes because we know total 25 units we are supposed to complete within the 16 classes, 8 plus 8 classes. Preparation of notes and giving the notes is not that much easy. Okay. Only thing is, actually, if the technical, anyone from you the technical is, or you can say, you have any idea, because I have my own that is PPTs now. How to share it to you? You will get guide you. Are you able to see this?
No, sir.
PPTs?
No.
Yeah. Is it visible? Hello.
Not visible, sir.
Visible.
Not visible.
No.
So in my laptop, some PPTs already prepared. I will try to make it possible. PPTs are not here in my laptop.
PPT is not visible. That's why My asking, sir.
Now are they visible now? No.
No, not it.
No, sir.
No, not yet.
Sir, if possible, you may share it later, sir.
How to share this PPTs? Now,
No, sir.
are they visible now?
Now it has come.
Yes, sir.
Okay.
Yeah.
Yeah.
What is counseling?
Yes. Is it okay now?
Yes,
Yeah.
counseling is a process.
Okay,
Yes.
okay.
Just see, already it is in 17th unit now. We are in 17th unit. Right from beginning, just through this PPTs, I'll sum up total this thing. It's okay? Yeah. Hello.
But what is it you said, sir?
So here we are
Yeah.
in 17th unit. We are discussing the 17th unit now.
17th unit, yes.
Yeah, but these are the slides that I'm showing here is right from beginning of your counseling.
That's right.
That is that is course.
Yes, sir.
Okay, if I revise all those these topics, is it okay today?
Yes, sir.
Wonderful.
No problem, sir.
Wonderful. It
Yeah,
is-
yeah. Because I have some PPTs. That is the reason I want to revise total topics. Okay.
Yes, sir.
Only in brief. Okay.
Okay, sir. Please, sir.
Right. So counseling is, what is counseling actually? Counseling is a process wherein the counselor helps the client in an interpersonal situation. Okay.
Yes.
Counseling refers to various skills and principles of helping. See, basically, counseling is the helping. Counseling is the helping in order to resolve some issues related to the client or the person. Okay. Here, we need to use some skills and principles of helping. Principles means, as I mentioned, the previous sessions also, previous class also, principles of our psychological principles, laws of psychological, yeah, it is theoretical principles. Okay, theories, laws, and principles. Here, counseling refers to various skills and principles of helping. Principles of helping, not our own principles of helping. The principles related to the subject. Then counseling involves helping others to understand themselves better and to be more effective in solving their problem. We need to understand the person in a better manner so that we will be in a position to give effective solutions. Effectively, you can act in solving their problems. So finally, counseling is helping others to help themselves. Got it? No need of just helping. Every time it's not so easy, it's not possible to help them in every instant, in every event. That is guidance. But here, once the client once the client approached the therapist or the psychological professionals, in order to solve their problem, in order to solve that particular issue, we empower the client. So counseling is helping the client to help themselves. Yes. Next, Then aims of counseling. There are some objectives or aims of counseling. One is information giving. Some cases we need to provide some information to the client related to this. Yeah.
Sir, if you press F5, then full screen will come, sir. This is visible, but that will be slightly bigger.
F5, no?
Yes, sir, F5.
Control F5.
No, only F5, sir.
Sometimes F5, if it is not working, you should use control. FN function key. FN plus F5.
F5. 1 minute.
Otherwise, at the bottom, there is one small screen. Yeah, it has come. No. It is...
The bottom?
At the bottom, you can see that horizontal bar is there. Left to that, one small screen kind of thing is there. Please click that, sir. Left. No, not that, sir. Go to the left. Go to the left. Not that, sir. There is a small... Yeah, right. Next icon, sir.
No, that cup.
Cup shaped. Yeah, this is also okay.
Right.
Okay.
Is it okay now?
Yes, sir. Perfect, sir.
Yeah, aims of counseling is that. So here, yeah. So information giving. So the information related to the client issue. Okay. Information. What are the information you have related to the issue? We are supposed to give that information. Next one is giving emotional support. Yes. Some occasional with their emotional disturbances, they may come to you. They may approach you as a psychological professional. We need to give some sort of emotional support. Then promoting insight. That is also one of the major aim. So insight improvement or promoting insight, providing insight is the other.
Sir,
yeah.
Sir, I'm not able to see the presentation. Slides.
Not visible.
Not visible slide?
No, not visible.
Just now.
Suddenly vanished.
No?
No, sir.
Sir, press escape, sir. ESC key on the top left. Maybe it is a full screen.
Now?
No, sir.
Probably again you have to reshare it. That might got closed.
Now?
Now it is okay.
Okay.
Yes,
Is it
sir.
visible now?
Yes, sir.
Yeah. Promoting insight means, so sometimes what happens, the client, whatever his capabilities, his competencies, he may not be in a position to acknowledge it, though he has some sort of positive aspects, competencies, but he may not be, she may not be in a position to identify those competencies. That is our responsibility, our aim to show or to improve insight, to show their capabilities. Okay, strengths, you can say. Then conflict resolution, some sort of conflict may arise, maybe the family conflict, conflict related to his job, conflict related to his interpersonal or intrapersonal conflict. Interpersonal means person to person, conflict related to person. Intra means within the person only, some sort of conflicts. Those things also we need to resolve. Then decision making, some type of counseling is needed when he or she is not in a position to decide. At least in process of decision making also, we have to counsel the client. Then problem solving. That is, problem solving is the ultimate aim of counseling. Okay. Then so these are the counselor qualities. So we need to maintain these type of qualities. That means personal and professional qualities of counselors are very important in facilitating helping relationship. Essential qualities of good counselor. One is self-awareness. Okay. Honesty. Congruence. What is meant by congruence? Congruence means whatever we are giving, whatever we are telling, whatever we are advising, that should be in a practical manner. Congruence. Okay. So counselor competence, acceptance. We need to accept the person as he is, as she is. Then trustworthiness, respect for people. Okay, maybe the problematic issues may be there, but you have to respect the client. That is another important quality of counselor. Open-minded. Always we have to be with open-minded. Then caring and empathetic. Caring and empathy. Empathy means understanding from the others' perspective. Yeah. Objective, not with subjective things. Always to be objective. Okay. Integrity. You need to integrate all the various information so that based on the integrated information, we need to advise the client. Sensitive. We need to sensitizing whatever the issues of the client, that we have to sensitive. Then patience. It is most important. The quality of a psychological professional. Good listener. Repeatedly, I am talking about the good listener. Listening skills are more important. Listening skills means the more you listen, the more you can understand the client. The more you listen, the more you can assess the situation of the client. The more you listen, the more you can give an opportunity to express their emotions. Okay. We know some are the micro skills of listening. What are the micro skills of listening? Solar, our sitting position. O is open mind. L means lean position. E means eye contact. R is relaxed. So these are some micro skills of listening. So good listener, as a counselor, we have to be good listener. Ability to communicate. So through your communicating skills, you have to be the counselor. Non-judgmental, because we are not the judicial persons. We are not judicial officials. We are the counselors, psychological professionals. You are wrong. So whatever you have done is a mistake. That is not our judgment. That should not be our judgment. It should be a non-judgmental, non-threatening. If you do this, then only it is possible to. Not like that. It should be a non-threatening, non-dominant. What happens if you are dominating? Please, please share your opinion also, please. You can try to interact. What is non-dominant?
Imposing.
Is imposing our ideas onto them.
Dominant. What happens?
And not listening to their view, rather.
Yes. Because if you dominate the person, he may not or she may not be in a position to express their emotions full-fledged. Okay, even voice modulation also very important. So it should be encouragement to say something. We need to encourage the client to share their emotions. If you use some sort of dominant voice, whatever they wanted to tell, they may not be in a position to express their emotions. So non-judgmental, non-threatening, non-dominant, and whole person. Okay, holistic manner. You need to act as a holistic person, holistic manner. This is other qualities of the artist. So conditions for counseling. What are the conditions for counseling? One is two persons are in psychological contact. The counselor and the counselee should be in a psychological contact, emotional contact. The first person is the client who is vulnerable and depressed condition. No, the second person is counselor who is calm and composed. The counselor should experience unconditional positive regard. What is unconditional positive regard? Unconditional positive regard means no conditions from our side.
Right.
So always we are ready to listen whatever conditions may be from the other side. We don't have any conditions. It is unconditional. Number one. Number two is positive regard. Always be positive from our side. Unconditional positive regard is the another condition. The counselor should experience the empathetic understanding of the client. Repeatedly, I'm talking about the empathetic understanding.
Yeah.
Okay. Then client perception of unconditional positive regard and empathy. So client perception, not your perception. Client perception of unconditional positive regard and empathetic understanding. Okay. Then stages of counseling. These stages of counseling already we discussed in the previous topics. Okay. So see these slides already in our previous units we already covered, but it is just like a repeat. Okay. Then stages of counseling. First one is initial stage. So in initial stage, what to do? Establishing the rapport. Establishing the rapport. Okay. Through your verbal or non-verbal communication, we have to build up the rapport establishment or rapport building. Initial stage. Maybe it will take some 1 or 2 sessions, but maybe 1 session or 1 or 2 sessions. Developing the harmonious relationship. Okay, this is most important, harmonious relationship, so that he will be or she will be in a position to
answer,
share their emotion, express their emotions. So these two important aspects are important. This is essential in the initial stage. Second is the middle stage. So in the middle stage, information gathering through different sources. Through your observation, you have to get some information, or through some other source of caregivers, or directly from the client, information gathering. Now allow the client to express their emotions freely. Okay, expressing their emotions freely. So this is the second stage, you can say middle stage. In this middle stage only, we have to assist the client in the process of information gathering. Then whatever their emotions, whatever their feelings, whatever their issues, let them share in a free manner. Allow the client to express their emotions freely. Okay. Then now in this middle stage only, what are the techniques, what are the therapies you are able to share? What are the advice you wanted to give? That advice also you have to give in the middle stage. Got it? Information gathering. Allow client to express freely. Then whatever the therapies wanted to use, that also we need to use in this middle stage. Got it? Then terminal stage, third stage, means whatever your advice, you need to recap it. Recapitulation. What are the therapies? What are the advice we are giving? What are the counseling process we have done? You need to recap it. Recapitulation. Then future plan of action. It is your advice in a different stages. Initially, establishing rapport, developing harmonious relationship. The middle stage, information gathering, assessment, allow client to express their emotions freely. Here also, you can give some sort of advice. Okay. Here, recapitulation means whatever their information, you need to repeat it, recap it. And whatever the advice you wanted to give, that advice also you have to repeat it in the recapitulation process. Then now future plan of action. Future plan of action is what to do from this particular stage. For example, so you are giving some sort of plan of action. For example, any couple counseling, any counseling related to their family, any counseling related to their addictions, okay, substance abuse, behavioral issue of the children, so parental counseling. So these are the plan of action we need to give to the client as well as the caregivers. Then follow-ups. We have to give some sort of sessions for follow-up services. This is the stages of counseling. Now, here counseling skills, in listening skills, influencing skills, helping, responding with empathy. These are the some skills that we have to use in the counseling procedures. So here listening skills means door opening, means would you like to talk about it? So this type of words we have to use in the listening skills. Okay. Okay. Yeah. Sometimes he or she may not be in a position to express their emotions. Here, if they are in the confused state, you can use this word. Would you like to talk about it? Would you like to talk about your husband? Would you like to talk about your this issue, so-and-so issue? That is the way you need to encourage the client. Okay, like minimal encourages. Go on, yeah, right. That is the non-verbal ways of communicating, encouraging the client. Then attentive skills. From a few seconds to 2 minutes, attentiveness. Attentively, you need to listen. Okay. So whatever they wanted to tell, let them tell. Let them share their feelings. Let them share their emotions. Okay. So these are some listening skills. Then influencing skills. Through your verbal or non-verbal communication, through your listening skills, we have to influence the other person. That means client. Influencing skills means if you understand the problem in a better manner, that is one type of influencing skill. Then supporting. Through your verbal or non-verbal communication, you have to support the client. Then giving some suggestions. Through your understanding capabilities, through your support system, through the suggestions given by you, that give some sort of that will give some sort of impact on the client. It means influencing skill. Now helping. Yeah, in helping also, as I mentioned, these are some counseling skills, listening skills, influencing skills, then helping skills. Okay. So in helping skill, stage 1 is exploration. Means help explore the problem, attention giving, and active listening. This is one type of help you are giving to the client. In stage 2, some sort of new perspectives, communication skills, verbal and non-verbal. In stage 3, in helping, there are different stages of helping. Initial stage, stage 2, that means initial stage means to help explore the problem. Attention giving and active listening. When you are giving attention, when you are paying some sort of attention, that is initial help. In stage 2 of helping, new understanding, new perspectives. So here in the new perspectives, your perspective may be different, his perspective or her perspective may be different. New perspective, new way of understanding their problem. Okay, this is also one type of help we have to provide, we have to give to the client. So his understanding capabilities may be different. See, when any individual, what happens if he or she is in emotional disturbance state, he may not be understanding or she may not be understanding their own self. Here, new perspective, new direction of understanding the issue in a better manner. Through your communication skills, verbal or non-verbal, you have to provide some sort of new perspectives of their issue, new understanding of their issue. That is stage 2. Any doubt here? Am I clear?
No, sir.
In
Yes,
stage
sir.
1 of helping means just attentiveness, active listening. That is one sort of helping in the starting stage. In starting stage 2, in helping stage 2, new understanding. Their understanding maybe somehow it is the routine understanding of their own self, their own issues. As a psychological counselor, as a psychological professional, we have to give some sort of new perspectives of their understanding through your communication skills. Okay, that is also one sort of helping. Then stage 3, action means to plan, implement, and evaluate. Creative thinking. That sort of creative thinking, problem solving, and decision making. Okay, plan of action and evaluating. I repeat this helping. This is a major aspect of helping. One is in stage 1, help through our active listening or attention giving. So that this is one type of helping to explore their issues, to share their issues. Second is new perspective of understanding, new understanding.
Communication skills, verbal and
Through
non-verbal.
the communication skills. You need to communicate the new understanding, new perspectives of their issue. They may not be in a position to understand their own issue in a better manner because of their emotional issues. They are in the vulnerable condition. That is the reason, though they have their capabilities, but their understanding may be somehow different because of their emotional situations. Here, as a counselor, as a psychological professional, that is our responsibility to help them in understanding their problem in a new way, in a new perspective, in a new angle, in a new direction through your communication skills. And stage 3, so creative thinking, better problem solutions,
Implementation.
and plan of action, and evaluating their own issues in a different way, in a creative way, in a new way, in an innovative way.
Implementation of thinking.
Yeah. Now empathy. Empathy is a form of human communication which involves both listening and understanding, communicating, understanding to the counselee. As a counselor, we have to understanding from their perspective, not from our perspective. Yes? So when we use this type of empathical understanding, empathy means you have to be there in their issue. You need to understand that issue is your own issue. You have to be there in that condition. If you need to imagine that if I am there in that situation, what happens? How I respond? How I act in this condition, in this situation. Okay. That is empathy. A helper cannot communicate an understanding of the client's world without getting in contact with that world. You have to be there in their world. Empathy in this sense is primarily a model of human contact. What empathy is that? In Telugu, one word is there, Parakaya Pravesham. I mean, how many of you Telugu background? Most of you are in Telugu background. Parakaya Pravesham. What is Parakaya Pravesham?
శంకరాచార్యులు వారు పరకాయ ప్రవేశం చేసి రాజుగారిది ఫీలింగ్స్ తెలుసుకున్నారు.
అంటే ఏమవుతుందంటే అక్కడ, సో యూ హ్యావ్ టు బి ఆ వాళ్ళలో మనం దూరిపోవాలి. దట్ ఈస్ పరకాయ ప్రవేశం.
వాళ్ళ ప్లేస్ లో మనం ఉంటే అలా ఆలోచిస్తాం.
ఆ ప్రాబ్లం లో మనం ఉంటే
అలా ఇన్వాల్వ్ అయిపోవాలి.
Yes. If you show sympathy is different. Empathy is different. Sympathy just giving, for example, if you are ఎక్కడన్నా మనం ఎక్కడో ఒక బెగ్గర్ కూర్చుంటాడు, లేకుంటే ఒక నీడీ పర్సన్ కూర్చుంటాడు, just giving some 10 rupees, 100 rupees, just it's sympathy. But if you visualize, if you think, if I am there in that condition, in that vulnerable condition, how I react. We need to realize.
Putting ourselves in their shoes.
Yeah, yes.
How can solve the problem? How can...
Got it? That is empathy. Yeah. Now, here, counseling techniques, previous class, counseling techniques. Okay. Counseling techniques, some are the verbal communication. In previous two, that is 13th or 12th unit, I think it is verbal communication, language of voice. Okay, it is mentioned the communication. It is counseling techniques. In our 12th unit, it is mentioned. Okay, there are some techniques of counseling. One technique is that in a 12th unit. One technique is that previously already discussed this, but I am showing this. That is this communication skills means in 12th unit there are different type of skills, counseling techniques. This counseling technique topic is in the 12th unit. In 12th unit, counseling techniques means verbal communication technique means how the language that you are using. What is the voice modulation is there or not? Sound, tone of voice, clarity. Clearly you are communicating it or not. Pitch, then modulation of your voice and authority. Okay. Modulation of voice, especially this modulation of voice generally we use in the telephonic or online counseling, because one-to-one counseling is one aspect. Second is the telephonic counseling and the
non-verbal communication.
Yeah. So here in the non-verbal communication, attending, active listening, personal space, eye contact, facial expressions, touch, context. These are the non-verbal communication techniques. In counseling techniques, one are the communication, verbal and non-verbal. Second is the therapeutical techniques. In counseling techniques, one technique of counseling is communication, maybe verbal or non-verbal. Second technique of counseling is the therapeutic techniques. In therapeutic techniques, there are some therapies. One is inclusive therapy to reduce anxiety from top of hierarchy. So in the previous class, 2 weeks back, I just explained this type of techniques. Okay, to reduce anxiety, that is one type of therapy that use inclusive therapy. Here in the inclusive therapy, the hierarchy will be from the top of the hierarchy to top to bottom. That is the inclusive therapy. Okay. Next one is aversion therapy. This aversion therapy generally we use in the
reduce temptation,
substance abuse cases, to reduce the temptation value of stimuli. Aversion therapy. Then generally this aversion therapy we use for the substance abuse cases like addiction of alcohol, to reduce their temptation value of stimuli. Okay. Then systematic desensitization. This systematic desensitization is to reduce the anxiety from low level of hierarchy, from low to top, from bottom to top. Impulsive therapy is from top to bottom. Like here in the anxiety means systematic desensitization for phobic case also you can use this systematic desensitization technique. Okay. Then another therapeutic technique is systematic use of positive reinforcement. What is positive reinforcement? Here in this case of behavioristic model, positive reinforcement. Okay, again I'll repeat this positive reinforcement in the 16th and 17th unit. Asset to training, relation time. Asset to training means how you are talking about, how you are way of talking. That is asset to manner of talking. Asset to manner of giving some sort of training to the caregivers or trained. Asset to training. Then relation training, how to maintain the relation within the family. This is a couple counseling. How to maintain relation within the group members in the workplace. This is also one type of techniques in the therapeutical procedures. Now, in the another this thing, one is 13th in the 13th unit, some sort of counseling techniques. There are different types of counseling. As I mentioned, marital counseling, then premarital, postmarital counseling. The 13th unit, counseling for marital, sexual, family, women, and elderly counseling. So in marital counseling, one is premarital counseling, that means counseling for better marital harmony, and counseling to eliminate marriage from the breakups. Premarital and postmarital counseling. Premarital and postmarital counseling. Then crisis in marriage. Crisis in marriages, that is factors affecting the marriages, social life, and the private life. Counts the role in marital counseling. Okay. So this is marital counseling. Then some sort of sexual issues like gender identity, transgender, unsatisfactory sex lives, and affairs, infidelity, fear of intimacy, changes after birth of the children. We discussed these issues in the last classes. Okay, that is marital counseling. Then the counseling related to the family. In family counseling, women counseling, that means changing role, lower economic status, social status, stereotype belief systems, inferior and dependent. These type of family counseling related to the women. Then elderly counseling. Elderly counseling means so orientation of retirement, financial planning in the retirement stage, leisure planning means leisure time planning, loss of spouse, some cases in loss of spouse in their age of retirement, health issues of these elderly people, some sort of loneliness and isolation issues. Okay. Then counseling to older adults to reduce depression and other elderly problems in old age. Elderly problems maybe some health issues like Parkinson's disease, stroke, heart disease, cancer. Okay, diabetes, thyroid, vitamin deficiency, some sort of dementia, that is dementia like Alzheimer's dementia. These type of issues also we need to counsel in the family. Then how to counsel using some therapeutic techniques. Okay. Now these are the some major counseling approaches. Here, one is psychoanalytical approach, behavioristic approach, affective approaches, cognitive approaches. Now this psychoanalytic approach already we already discussed it. Okay. Psychoanalytic approach in the last class, I think it was yesterday's class. Psychoanalytic approach means, see my dear students, please listen here. Any counseling technique, any counseling skills, any counseling advices, okay, there are 3 stages of counseling. First of all, we have to use the theory related to that particular issue. Second is the approach or you can say therapeutical approach. Third is counseling procedures. I repeat, first one is theoretical aspect. Second is therapeutical approach. Third is our counseling. One example I'll give you. In psychoanalytical approach, we already discussed yesterday. In psychoanalytical approach, systematic desensitization, aversion therapy, free association. These are the three therapeutical approaches we follow in psychoanalytical approach. Before psychoanalytical approach of using the psychoanalytical approach, what to do? We have to understand the psychoanalytical theory first. Am I clear?
Yes, sir. Yes, sir.
Psychoanalytical theory of Sigmund Freud, if you understand better, based on the psychoanalytical theory, how to use the psychoanalytical approach. Got it? Yesterday, thoroughly, we discussed some sort of psychoanalytical theoretical aspects like topology, structure of mind, then different stages of psychoanalysis, defense mechanism. Okay, these are the theoretical basis we have to understand before using the psychoanalytical approach. Psychoanalytical approach means systematic desensitization therapy, aversion therapy, free association. Yesterday we have discussed. These are the approaches. Now, based on the approaches, our counseling tips, counseling advice, counseling procedures. Am I clear?
Yes.
Theory, therapy, then counseling. Please try to understand. Then only your counseling will be effective counseling. Out of our own knowledge, you can't give any counseling. That's not the psychological counseling. Repeatedly, I am talking about the counseling. Psychological counseling is most important. So now, behavioristic approach. In behavioristic approach, see, like I mentioned here, behavioral modification therapy. So to use behavioral modification therapy, some sort of behavioristic theories we have to understand, please. But behavioristic theories means one, classical conditioning theory. Second is operant conditioning theory. Third is social learning theory. These three theories are backbone of the behavioristic approach. Got it? For psychoanalytical approach, Sigmund Freud's psychoanalysis is the foundation of the psychoanalytical approach. Likewise, operant conditioning theory, the combination of these all theories are the foundations of behavioristic approach. For example, if you use behavioral modification therapy, now we are in the 14th, 15th, and 16th. These are all the 14th and see, 14th is the counseling for children with behavioral problems. No? Then in 16th also, in 17th also, 17th, okay, 14th and 17th. If you see the 14th unit and the 17th unit, these both units are related to the behavioral issues. 14th is counseling for children with behavioral problems. Means the problems are related to the behavioral issues. Okay, for these behavioral issues of 14th unit, like children, autistic cases, ADHD cases, okay, these specific learning disabilities, or any other behavioral approaches, behavioral issues. Okay, so here in the 14th unit, we discussed what are the various behavioral problems of the children. Now in the 17th unit, how to use the behavioristic approach, behavioristic therapy to these behavioral issues. Got it?
Yes, sir.
Yeah, clear?
Yeah.
Please try to, just if you have any doubts, please ask. Today's class is the most important. We are total overall view we are giving to this particular counseling psychology this paper. Here, as I mentioned, the 14th unit is the problems related to the behavior of the child, or you can say children with behavior problems. That is the counseling for children with behavior problems is the 14th unit. 17th unit is that how to use behavioristic approaches to the problems of the behaviors. Okay, what are the behaviors now? As I mentioned, we have to identify the behavior first. Okay, first one is the identification of behaviors. That means which behaviors? Abnormal behaviors, or you can say problem behaviors. First one is the identification of behavior. Second is eliminating the behaviors. Some behaviors can be eliminated, but some behaviors may be reduced. Eliminating the behavior, unwanted behavior. Second is promoting desired behaviors. Third is reducing unwanted emotional responses. Reducing unwanted emotional responses. Okay. Now, what are the basic theories of this particular behaviors approach? One theory is that classical conditioning theory. In classical conditioning theory, according to the Ivan Pavlov, who is the proponent of the classical conditioning theory?
Pavlov.
Ivan Pavlov. According to the Ivan Pavlov, there are some conditioning, classical conditioning. So here conditions are that unconditional stimulus, unconditional response. Conditional stimulus, conditional response. So some conditions. Yeah. You might have heard about this theory with some rat, some sort of pigeon, dog. There are some animals they used in their experiments. Okay. In order to modify that behavior, we use some reinforcers. That reinforce may be positive reinforcement. Second is the
Negative
reinforcement. In operant conditioning theory, why this classical conditioning theory is known as the S-type theory? Why that operant conditioning theory is known as the R-type theory? In S-type theory, stimuli is the dominant aspect of the classical conditioning theory, whereas response is the dominant aspect in the operant conditioning theory. Stimuli, conditional stimuli linked with unconditional stimuli. So the response, based on the stimuli, response. Okay. So you know that experiment, that is how that the food we will provide to the animal. Okay. So some sort of bell we will arrange along with the food. The conditioning is that before provide the food, we will give some sort of sound with bell. Okay. The conditioning is that if you want to get the food, before providing the food, sound. So the connection between the sound and the food, that is connectionism, connecting, conditioning. The condition is that you will get the food, before getting food, some sort of sound. Condition is that. So here, based on the stimuli response in the classical conditioning theory of Ivan Pavlov, that is the reason. This is known as the S-type theory. In R-type theory, the more response, see, you know that rat, first of all, by doing some efforts, that rat will get the food. Okay. If the food is, that means the response is the food. based on the food, it will, or that rat will give some more efforts. They try to effort more. Efforts are more. So here, based on their response, the stimuli. That is the reason operant conditioning is known as the response theory, R-type theory. And in the operant conditioning theory, some sort of reinforces. So based on the modification of the behavior, positive reinforcement. If the behavior is not modified, the same sort of desired or problematic behaviors are showing by the child or by the person, by the individual, what happens? Negative reinforcement. We have to choose what are the positive reinforcers, what are the list out the positive reinforcers, list out the negative reinforcers. Okay.
Yes, sir.
For example, in this case of it is ADHD or it is artistic cases, we know that some of the symptoms of autism. One is restlessness, not maintaining good eye contact. So here, so restlessness is there. Take the restlessness, ask them to wait to sit for 3 minutes initially. If the child is practicing to sit for 3 minutes, that means before your counseling, before the therapeutic procedures, sitting tolerance is low, only for 1 minute. Okay, now sitting tolerance is improving up to 3 minutes. So he or she is able to sit for, he's practicing. That means he is or she is modifying his behavior. That is behavior modification therapy, behavior modification technique, BMP or BMT. So if he or she modifies his behavior, you need to provide some sort of positive reinforcement. In providing the positive reinforcers also, there are some techniques, stage-wise. Okay, just with smile, the mother communicate non-verbal communication, or even the therapist, a positive manner, positive reinforcement in order to provide positive reinforcement to the child. If you smiles, your facial expressions also one type of positive reinforcement to the 4 years or 3 years child having autistic issue. That means through your smiling face, through your smiling expressions, he or she is ready to modify his behavior further. That is one type of positive, first level of positive reinforcement. And clapping, saying very good, excellent, writing on the book, very good, excellent, or giving some sort of stars. These are all various levels of positive reinforces if he or she modifies her behavior. That is behavior modification technique. So positive. The same way, list out the negative reinforces. Okay. Negative reinforce means you can tell them, if you are not modify your behavior, if you are not sit at one place, if you are not listening this, if you are not practicing this, I will reduce whatever the tangible things. That you have to tell first. Initial stage, you need to tell the negative consequences if he or she shows that undesirable behavior, abnormal behavior. So by providing positive reinforcement or negative reinforcement, you can modify their behavior. That is behavior modification technique and behavior modification. Any doubt?
No, sir.
See, there are some other techniques of behavioral therapy. One is conditioning therapy, reinforcement, then shaping. Shaping means, so their behavior to be shaping means some sort of methods you have to show to the child, to the individual. Or you can say prompting. His speech is not up to the mark, some sort of stammering, some sort of stuttering. So we have to prompting that, shaping their behavior by showing some sort of models. Then token economy. If you do this, these many tokens I'll provide. That is also one type of technique in modification of the behavior. Okay. In social and cognitive modeling means modeling and self-observation. Ask them if the child is around 10 years and 12 years age child. So better to ask them to observe on their own. That is self-observation. Modeling. Okay. A reality therapy also one of the important tests. So ask them to behave in a real manner. So these are all the various techniques that is to be used in modifying of their behavior. Shaping, generalization, discrimination, and punishment. Punishment means the response is followed by discomfort or indesirability. The response will be suppressed, but not. So here, punishment is not that punishment. Punishment means reducing. But for example, if they want to go some other place, weekends or some sort of objectives, some sort of play activities, some sort of play items. You can tell them, so I wanted to provide these play items, or I wanted to do some eatable things. I wanted to bring some eatable things. I wanted to provide some eatable these things, but you are not modifying your behavior. That is the reason I am not providing that. Though I wanted to provide it, I am not. This type of negative reinforcers, if they are not in a position to modify their behaviors, means undesirable behaviors are continuously, if they show abnormal or undesired behaviors, you can reduce whatever the play items. You can tell them, I'll reduce their play items. I won't bring your play items. I won't provide these eatable things, because you are continuously showing those abnormal, undesirable behavior. This is also one type of negative reinforcement. Then in self-observation also, there are some observational learning, 4 basic functions of self-observation. One is attentional process. Self-observation or observing their models. Okay. In observation, attentional process. Attentively, they need to pay attention in observation. Attention is an important factor of observation. Okay. They have to, the child or the person, the individual, the client are supposed to observe their models. Then retentional process. In self-observation, one is attentional process. Second is retentional process. Whatever they observe, whatever they attend to aspects, whatever they observe attentively, that should be in their mind. That means retention process. Third one is motor reproduction process. Imitating. Then motivational process. They are supposed to motivate by their own self by seeing the others. Self-motivation or internal motivation. Second is the external motivation. Through the motivational process, you can reduce their or eliminating their or modify their abnormal behaviors. Some sort of therapies for specific disorders that is also related to the behavior modification technique. For example, for some sort of phobia, phobia means agoraphobia, okay, specific phobias, okay. So then OCD cases, then depressive cases, some sort of cases related to their abnormal behaviors. Okay, better to reduce their behavior, better to modify their behavior, better to reduce their undesirable behaviors through the behavior modification technique. As I mentioned, behavior modification program, the basis of the foundational basis of the behavior modification program is that learning theories. Okay, operant or you can say conditioning theories, operant conditioning theory, then classical conditioning theory, then social learning theory, the Banduras. Banduras, classical conditioning theory, the founder of the classical conditioning theory is Ivan Pavlov. Then founder of the operant conditioning theory is Skinner. Then social learning theory, the founder of the social learning theory is the Albert Bandura. These three theories are basis of the behavioristic approach. In behavioristic approach, major technique that we use is behavior modification technique or behavior modification therapy. In behavior modification therapy, self-observation, reality therapy, modeling, okay, token economy, and some sort of reinforces we have to use in based on the operant conditioning theory. Then in self-observation is based on the social learning theory. By observing the others, by observing the self, by observing the family members, by observing the teachers, by observing the siblings, by observing the these elders, there is a chance of modifying the behavior of the any measure. Again, in the observation learning, there are basic functions. One is attentional process, retentional process, motivational process, then reproduction process, model of reproduction. We need to reproduce whatever you learned, we have to reproducing it. Even for some specific disorders also, we need to use this type of approaches, behavioristic approaches. For example, like phobia cases, maybe phobia may be general phobia, general anxiety disorder, GAD, anxiety disorder, and specific anxiety disorder, like phobic cases. OCD cases, depressive case, child depression cases, or individual depression case also, we can use this sort of behavior approaches like behavior modification techniques. Any doubt? Yeah?
No, sir.
Any doubts? Can you please ask if any doubt?
No doubt, sir.
Sir, one clarification.
Mm-hmm.
In operant conditioning,
Yeah.
how the response comes first, followed by stimulus. That I have not understood.
Please loudly, please.
In operant conditioning,
yeah,
how the response is followed by stimulus and not vice versa.
Response is
Followed by first response, you said, isn't it, sir?
yes.
How the response comes first? Because
Okay.
response is always, common understanding is against some stimulus.
Mm-hmm. Mm-hmm.
Or imbalance or new thing in the environment, whatever we have.
Mm-hmm. Mm-hmm.
So that doubt remains in my mind always. Could you clear kindly?
See here, for example, in the experiment, rat, okay, That is even rat, even pigeon also. The pigeon or rat, in order to get food, they'll some sort of trials, some sort of effort, some sort of activities they'll do.
So the food is the stimuli, I feel, isn't it?
No, food is not stimuli. In this case of operant conditioning,
Uh-huh.
getting food is the response. You are talking about the classical conditioning theory. In classical conditioning theory, stimuli is the main. That is the reason we are calling it as a stimulus or escape theory. Whereas operant conditioning theory is a response by getting food. Effort, doing some activities, the stimuli, getting food is the response. I'm talking about the operant conditioning.
No, that's right, sir.
Okay. So here, after getting food, for more food, it will give some sort of activity. It will try to get some more food. So based on the quantity of the food, because based on the response of the instant, so the more efforts. I'm talking about the operant conditioning theory of the Skinner.
That means, shall I take it? Because Skinner called it so, we have to call it so.
Then
it is okay.
Yeah.
Yeah. Because Skinner said that the rat is making efforts, that is the response. And that is the terminology you used. So that is sacrosanct and we must follow it.